started noticing these small dull aches, kind of like a toothache, in the back left side of my mouth. I would also get these weird headaches that would disappear after just a few seconds. I'd had a root canal following an infection that summer, so when the pain went on for about a month, I went back to my dentist. We couldn't find anything wrong. Throughout the fall, the headaches appeared more frequently, and my teeth and neck started to hurt on my left side. I went to my dentist and he figured the problem could be a wisdom tooth, so he removed my top left one. The week before Christmas, I started to have these massive episodes of jabbing pain, like someone was stabbing me in the jaw with an ice pick. 3 days before Christmas, I got a stab of pain so painful that I passed out. I made an appointment with my physician that night. He couldn't find anything wrong, but when I told him about the root canal and infection, he prescribed an antibiotic and painkiller. I could barely celebrate Christmas that year. I spent a majority of the day crying on the couch, but I didn't want to go to the hospital on a holiday. When I went to the ER the next morning, the pain was so intense, I felt like I was being electrocuted. I felt like my heart was going to beat out of my chest and my blood pressure was through the roof. I felt like I could die if they couldn't fix me today.
Now it's time for you to be the doctor. Remember the patient's symptoms include extreme pain along the left side of her head, neck, and jaw, high blood pressure, tachycardia, headaches, and the occasional loss of consciousness. Do you think she has A. a myocardial infarction, B. an infection caused by an antibiotic-resistant strain of bacteria, C. stroke, D. a compressed nerve, or E. bone cancer?
I'm Yamado Joshi Chen Solovetsky's doctor. When she first appeared in my office, you could tell she was in a lot of pain. We had her tested for infections, heart attacks, strokes, but everything came out normal. We started using CAT scans and MRI to figure out what was going on, but everything showed normal. Later on, I had asked her what she feels just before the pain starts, and she told me that she feels wind on her face before the pain starts. And that's when I knew what she had.
Now it's time for you to be the doctor. Remember the patient's symptoms include extreme pain along the left side of her head, neck, and jaw, high blood pressure, tachycardia, headaches, and the occasional loss of consciousness. Do you think she has A. myocardial infarction, B. infection caused by an antibiotic-resistant strain of bacteria, C. stroke, D. a compressed nerve, or E. bone cancer? If you select answer choice D, you are correct.
Hello, I'm Dr. Jackson. I'm a neurologist that specializes in trigeminal neuralgia. When I first met Yamado Yoshi Chinchorevetsky, she was desperate to find relief, and that she did in fact have trigeminal neuralgia. What trigeminal neuralgia is actually an artery compresses the trigeminal nerve in the face, and over time it wears away the myelin sheath and it exposes the nerve. It makes it a lot more sensitive than it should be. So you can, it can be triggered, pain can be triggered by just like wind, you feeling wind on your face. I informed her of the procedure we do that would cure her trigeminal neuralgia, and it involves cutting a incision, making an incision behind the ear, actually removing a piece of the bone, going in and putting a Teflon cushion between her artery and her nerve. When I actually cut her open, I saw that her artery has been compressing her nerve so much it actually left a dent in the nerve. Most patients are groggy after a surgery, but I just remember she cried after surgery because she was so happy that she did not have to live with that pain anymore.